Hello, nice to meet you. You may be reading this poster because you or your loved one was recently diagnosed with liver disease, and you are wondering, does my liver disease affect my ability to father children? The short answer is sexual dysfunction can be common in men with chronic liver disease. However, it is generally safe to father a child and treatment is available. Most men can successfully father a child. Your liver disease does not pose a risk to your fetus or lead to transmission of disease to your children. Now let's dive into it. What is male infertility? It is defined as inability to achieve pregnancy after at least 1 year of unprotected sexual intercourse. The low sperm count is defined as less than 15 million sperms per milliliter of ejaculate. What sexual dysfunction signs and symptoms might I experience, you may be wondering. It includes a wide spectrum of symptoms: fatigue, loss of armpit and pubic hair, erectile dysfunction, impaired sexual arousal, orgasm, or satisfaction, decreased sex drive, depressed mood, and decreased sperm count, sperm motility, and ejaculate volume. Here on the bottom left is a diagram that describes how liver disease can affect the hormone axis in our body and lead to decreased testosterone and eventually sexual dysfunction. Hypothalamus is a brain structure that releases hormone called gonadotropin releasing hormone. It acts as a signal to anterior pituitary to release follicle stimulating hormone and luteinizing hormone that then lets the testicles produce testosterone. However, liver disease can affect and impact on the hypothalamus pituitary axis and leading to decreased testosterone. So the impact of male fertility really is related to the specific cause of liver disease, the stage of your liver disease, and corresponding shared risk factors. The first bucket I wanted to discuss today here is the types of liver disease. Metabolic associated steatotic liver disease or mast cell fatty liver disease. This disease entity has been shown to be related to low serum androgen, altered sperm concentration, and sperm count. Its risk factors, for example, obesity, diabetes, high blood pressure, can cause decreased sperm quality. Alcohol use associated with alcohol-associated liver disease can lead to altered reproductive hormone regulation. Chronic viral hepatitis B or C infections can cause decreased semen quality and volume. Post-liver transplant patients, 50% of men may still have persistent erectile dysfunction or develop new symptoms. The second bucket I wanted to discuss is the medications for liver disease. Beta blockers, very commonly used for patients with cirrhosis. For example, carvedilol, propranolol, nadolol, can cause sexual dysfunction as one of its side effects. Calcineurin inhibitors, for example, cyclosporin, tacrolimus, can lead to decreased testosterone level. Currently, limited data is available for everolimus and sirolimus. However, CellCept needs to be stopped prior to fathering a child. The last bucket is the stage of liver disease. As you can see in the diagram on the bottom here, here is a healthy liver, and here is liver steatosis where there is increased fatty tissue in the liver. And here is the fibrosis of the liver where there is increased formation of the scar tissue in the liver. And cirrhosis is when you have the scar tissue taking over the healthy liver tissue. And lastly, is the liver cancer where there is malignant cells in the liver. And so as you may imagine, as the liver disease stage is more advanced, there is increased risk of sexual dysfunction. You may be wondering, what is the evaluation available for my sexual dysfunction? So definitely, please discuss with your doctor about your symptoms as the first step. There may be lab tests we can do, for example, endocrine function assessment to really look into your hormone level. And the treatment is really involved with treating the underlying disease and corresponding risk factors. It involves very close collaboration between your liver doctor and your reproductive specialist. In some cases, testosterone supplementation may be a treatment option. Here, the QR code is the references I used for creating this poster. Please feel free to scan the QR code and look into the available research in the field currently. Thank you so much for your attention.